every single illness, every single poison in the environment will have a negative effect on one of the vertebrae in the spine. And interestingly enough, when that happens, there will be a change in the fixed position of the human body. It's also very fascinating that many of the mobilization and manipulative therapies like osteopathy, chiropractic, and other philosophies of that nature will often do a correction because they can see that the body is in the wrong position. So they will enforce the correct position, and this is the belief that structure governs function, and therefore if we can correct structure, we can correct function. However, I would like to point out to you that there is something else that is much more important to understand, and that is that our whole structure of our body is not just controlled by the function of the body, but the function of the body is impacted by emotions. So we go around in a circle back again to this idea that when we are emotionally distressed for whatever reason and in whatever way, that will have an impact on the way our bodies sit. You lean into your troubles, you lean into your pain, and this is why the heart path formulas, which you've all studied, are so desperately important. If you lean to the right, you know that you're leaning into a pain which is spiritual or mental. Maybe the tricuspid valve is under duress, or maybe the pulmonary valve is under duress. It's very fascinating that the further you lean to the right, the more traumatized you are on that side of your body. And interestingly enough, if you don't support that trauma, that patient will continue to create that position of pain relief. Pain is very, very interesting, and it occurs in very many different ways. We have pain on all sorts of levels. We have pain, excruciating pain, pain that is so agonizing that it's almost unbearable. And when we are in a spiritual stress, we regard that as excruciating. So interestingly, people will tell you when they come to see you, I've got this terrible pain in my right hip. Immediately, you can assess the right hip, the upper right part of the leg, the upper right of the heart, obviously, and you've really got some very important information here. So listen to your patients talking, because they will tell you where their problem is. Observe your patient to see how they lean. What is going on? Do they lean forward to talk to you? Do they lean to the right? Do they lean to the left? Do they lean backwards? Some people arch their backs because they're in such pain.